Now I want to announce some key additions to our existing team that is fighting the coronavirus and additions to our administrative structure at the Ohio Department of Health. As you can see from the numbers, we are now at a critical juncture in our fight against the virus. Cases are spiking all across the state of Ohio. They are at an all-time high. At the same time, the good news is we're closer to getting a vaccine. As someone once said, it's always darkest before the dawn, but the light is coming. I'm confident of that, and so we need to be ready for that. Our game plan is straightforward and remains straightforward. The best way that we can defeat our common enemy is by doing three things. We must stick to the basics to not endanger ourselves, our families, nor others. That means back to the basics. Wearing masks, maintaining distance, not gathering in groups, especially inside. We almost continue to focus on protecting those that are most vulnerable of getting the virus. And we need to go on the offense with the pending arrival of the vaccine. Now, fighting a pandemic demands a multifaceted response, one that requires us to focus on our short-term needs, but also not lose sight of our long-term goals. And so it is very important that as we battle the virus, we continue to build out the Ohio Department of Health, because the Ohio Department of Health is the epicenter for this, and they are really carrying out two separate jobs, related but separate. One is the normal function of the health department, which is so vitally important to the safety of all Ohioans, but the other is fighting the pandemic along with their partners at the local health level. The work of the Ohio Department of Health and the local health departments, the work they both do, working together, is vital to the well-being of all Ohioans. We have spoken in the past of the social determinants of health, which include such things as income, education levels, physical and social environments, availability of health care and mental health treatment, and other support networks. Where you live and your zip code many times plays a significant role in the health outcome. That is true for many Ohioans. The Ohio Department of Health is the foundation for our effort to promote a healthy Ohio, working with the local health departments so that no matter where you live in this state, you have the opportunity to thrive, and that's the goal. Whether it is working on infant mortality issues or maternal mortality issues, well baby vaccines, protecting children from getting sick from lead poisoning, decreasing tobacco use, vaping, or fighting infectious diseases. The Ohio Department of Health is at the core of protecting all of us. And so in these unprecedented times, as the Ohio Department of Health fights the pandemic with its partners at the local level, it's equally essential that we continue to support the department's core mission and work and provide the necessary medical, management, and administrative expertise necessary for the department to run as well as it possibly can. This is a critical time. The good women and men at our Ohio Department of Health have been working nonstop since the beginning of the year to fight the virus, as have their partners at the local level. And I salute all of them. They're dedicated and committed and care passionately about protecting all of us in Ohio. I'm grateful for what each one of you do every single day. I've said before that this is like a sporting event, a football game, basketball game. And we're sort of at halftime. There's no pause in the action, though, but we're sort of halfway through. We are preparing to get a vaccine out. We're also dealing with the most serious surge that we have seen thus far in the virus. And so now is the time to bring in reinforcements to the team to go on the offense and to put more players, frankly, out on the field, especially as we prepare for the arrival and distribution of the vaccine. Now is the time in the game where we need to surge in, go back on the field, do everything we can to defeat our opponent. We will win this fight, and we will win it together. In the letter that I sent to all Ohioans on Sunday, I said, once the election is over, we've got to refocus our efforts on this virus. This virus doesn't care if we voted for Donald Trump, doesn't care if we voted for Joe Biden. It's coming after all of us. And what we have in common is a desire to keep our kids in school, desire to keep our grandparents safe in nursing homes, and a desire to keep our hospitals open and functioning so that no matter what the problem is, there's room in the hospitals. These are our common goals that bring us together as Ohioans every single day. Having a physician with medical and scientific expertise at the Ohio Department of Health is vital. And we do have doctors, and we rely on doctors outside and have continued to rely on them outside of the Department of Health, going back when Dr. Acton was at the Department of Health and was our health director. So it's been something that we've been very lucky to get a lot of help from some of our great universities, some of our great hospitals in the state of Ohio, and our great doctors. And so I thank them for that. We need to have a key physician, though, at the Department of Health who has a direct line to me and someone who I can rely on every single day. Also, someone who can reach out to other medical professionals around the country and get the best information that is available. Someone who can be the doctor for all Ohioans. So I'm very pleased to announce today that Dr. Bruce Vanderhoff, who has been serving for more than a decade as a senior vice president and as a chief medical officer at Ohio Health, has accepted the position of chief medical officer at the Department of Health. Many reasons why I've asked Dr. Vanderhoff to join our team. First and foremost, he has years of real-life experiences leading large teams and successfully dealing with important healthcare issues here in Ohio. He prepared Ohio Health to deal with the threat of Ebola and the H1N1 flu pandemic. He has grappled with the pressing healthcare issues affecting the entire state, from rural Appalachia to metropolitan Ohio, doing so in a manner that's both collaborative and effective. Dr. Vanderhoff is both a highly regarded physician and administrator. He received his Doctor of Medicine degree from the University of Pennsylvania, an MBA from Franklin University, and completed a residency in family medicine at York Hospital in York, Pennsylvania. He's become a nationally recognized physician leader with an impressive track record of addressing healthcare disparities and improving healthcare quality and population health outcomes. Under his leadership, Ohio Health has received many national quality recognitions, including top health system rankings. He's a proven consensus builder who has created institutional and community partnerships that have improved healthcare delivery in Ohio, including the establishment of Ohio University's Dublin Medical School campus, which is a nursing education partnership with Otterbein University, and the Physician Diversity Scholars Program, which is a partnership between Ohio Health and a number of Ohio's medical schools to mentor and support diverse students as they study to become physicians practicing right here in the state of Ohio. Dr. Vanderhoff is deeply committed to community service and is a recipient of the Phillips Medal of Public Service from Ohio University. He's been almost perennially recognized by Becker's Healthcare as one of the nation's top chief medical officers to know. He's been a member of the American Hospital Association Committee on Clinical Leadership, which is a select group of recognized national healthcare leaders charged with advising the Hospital Association on clinical care, delivery involving population health, healthcare disparities, and disaster response. Further, Dr. Vanderhoff is a founding member of the Healthcare Institute's Chief Medical Officer Group, which is a select group of physician leaders from some of the largest and most influential healthcare organizations in the nation. They share best clinical practices and develop strategic approaches to clinical issues, including population health, healthcare disparities, and responding to COVID-19. He is a member of the Vizient Large Health System Medical Executive Group. This includes physician leaders from large health systems and academic centers across our country who work to improve healthcare delivery for everyone. And closer to home, he has been a leader in numerous groups dedicated to improving the health outcomes for Ohioans across many age groups and demographics. We're delighted he has accepted this position.